This is the California State Senate.
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 Este es el Senado Estatal de California.
This is the California State Senate. This is the California State Senate.
This is the California State Senate.
Esta es el Senado Estatal de California.
This is the California State Senate.
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 pleasure. Nice to see you.
Hi, I'm Jack Herman. We met once.
Yeah, I remember.
Yeah.
Nice to see you.
I called you the wrong name.
I
called you Steve.
No, I didn't say that. I didn't say that. Come on, no, I'm not. No, I didn't say that. I didn't say that. I didn't say that.
Okay.
Where at? Okay. Well, good morning, everybody. Thank you for coming today. We're here to talk about SB 17, which is an essential step towards controlling healthcare costs here in California. Over the past several years, drug companies have been behaving in a way that demands action. They've developed a playbook that results in obscene profits at the expenses of the entire healthcare system. We've all heard the reports of these incredible price increases. Turning Pharmaceuticals raised the price of Diapram, a sole source medication used to treat cancer and AIDS patients with suppressed immune systems, by more than 5,000%. One variety of insulin that was developed in 1952 went up by 461% over an 8-year period. The price of one generic antibiotic spiked by 2,000% in 1 year. There is no way that a generic antibiotic suddenly becomes 2,000% more effective. In one example, which is particularly offensive to me, 1 month after California introduced our Compassionate Care Choice Act, the manufacturer of the most common aid in dying drug, Valiant, doubled its price. The fact is that drug companies don't tie price increases to effectiveness or research cost, or even to changes in the manufacturing cost. Price increases are based solely on what the market will bear, but drug companies don't operate in a free market, and at times there are monopolies. Patients who need access to particular drugs don't have the option to forego treatment or to find another option when the price gets too high. And these examples are not outliers. The whole industry behaves this way. It has become an arms race of profit generation. This bill, SB 17, requires drug companies to give 90 days notice when drug companies increase prices in a way that would be shocking in any other industry, in any other segment of the health industry. This bill, SB 17, also provides consumers a greater understanding of their share of drug costs by requiring health plans to identify the drugs that are driving the spending. We, the consumers, pay the healthcare premiums, and we deserve to know what our money is being spent on. Transparency-focused policies in California require other partners, including hospitals, health plans, and doctors, to provide greater transparency on price. Drug makers have escaped this openness, and why is that? They have an army of lobbyists paid to kill anything that exposes this shell game. When we've made price information publicly available in other sectors of the healthcare market, prices have normalized. And make no mistake, this bill may not have passed last year, but it's already having an effect. Since we introduced SB 1010, over 20 states across the nation have been following suit, and the industry has started to restrain themselves to avoid public scorn. It is working. Transparency works, and that's why drug makers will fight this bill. We have the support of a diverse coalition of business, labor, consumers, healthcare providers, local government, and we won't back down. And before I turn over to the next speaker, I'd like to just thank and notice those that are here. We have Project Inform, the Hep C Alliance. We have the Small Business Majority, California League of Cities, CalPERG, California State Retirees, California School Employees Association, Blue Shield of California. We've got CARES Community Health. We got California Nurses Association. We have Community Care Health Centers. We have a large coalition. I believe this coalition is not only going to stay here, but it's going to also grow as well. So with that, I'd like to turn it over to Assemblymember Chu and allow him to say a few words. Thank you.
Thank you. Let me first start by thanking Senator and Dr. Ed Hernandez for his leadership, and I want to thank all of you for being part of a movement to address skyrocketing drug prices. I've been part of this effort since my time as a local official when in 2013 in San Francisco, we helped to pass a ballot measure that was supported by 80% of my city demanding the negotiation of fair drug prices. During my first weeks in the legislature a few years ago, after Governor Brown included in his budget $300 million for new hepatitis C drugs, which cost $84,000 a treatment, I decided to author AB 463, which I thought would be a simple bill to require transparency for the most expensive drugs. Not over-the-counter stuff, but drugs that cost over $10,000 a treatment. We simply wanted to understand what it costs drug companies to produce those drugs. R&D expenses, manufacturing expenses, marketing expenses. Unfortunately, that bill was stalled in the Assembly. This past year, we've seen a national outcry over skyrocketing drug prices, not just from Bernie Sanders and Hillary Clinton, but from Donald Trump and congressional Republicans. But with the ACA under attack, no one is holding their breath that Washington will solve the drug price crisis. California must lead yet again. We don't have time to waste for the child who needs an EpiPen, for the Hep C patient who needs Sovaldi, for the AIDS or cancer patient who needs Martin Shkreli's Daraprim. We need answers, which is why I'm willing and honored to be the Assembly's principal co-author of SB 17. Drug price transparency is critical. Californians deserve to know why medicine costs so much. Why $1,000 for a Hep C pill? Why $600 for an EpiPen? Why are these prices 10 times the cost as they are in other countries? Every other major player in the healthcare world is required to provide transparency. Doctors, hospitals, insurers, health plans, even though none of them are provided with the patents that give what economists tell us is the monopoly power of the drug industry. And as that industry is telling us in the coming years to expect higher and higher cost drugs to come down the pike, as the ACA is destroyed, families, companies, and government will have to pay. And it's more crucial than ever that we stand up to demand answers. I look forward to working alongside Dr. Hernandez and this broad coalition that is demanding answers. Patients and consumers, employers and business, labor and working families, environmentalists, and health advocates. It's time to get this done. It's time to lift the veil on skyrocketing drug prices and to ensure access to life-savings treatment.
Good morning. I'm Tom Steyer. Our organization, Next Gen California, is dedicated to fighting for the rights of every Californian. And I'm here today because there is a crisis that threatens both the health and the financial security of millions of Californians. I'm talking about skyrocketing prescription drug prices. According to the Kaiser Family Foundation, from 2013 to 2016, prescription drug spending increased on average between 8 and 9% per year. And a recent report projects prices will increase 11% in 2017. This comes at a time when families are already struggling to afford their medications. And we are talking about billions of dollars. $69 billion worth of drug increases in the last 3 years. Horror stories like the ones that Senator Hernandez and Assemblymember Chu quoted are common over the last couple of years. Meanwhile, the drug companies continue to rake in profit at the expense of our families. So what can we do? SB 17 calls for basic transparency from pharmaceutical companies when they raise the price of medications. It is an essential first step to reining in costs. Today, the public has almost no power to hold drug companies accountable for price hikes. Consumers are forced to simply pay high prices for essential life-saving products without any explanation or reasoning behind it. Corporate pharmaceutical executives are making life and death decisions for millions of Californians behind closed doors. The price hikes are devastating, especially for those with chronic illnesses, the elderly, and low-income families. These increases blindside families and compound health crises with financial hardship. They directly hurt Medi-Cal and strain the health care for the state's most vulnerable families and pass the bill along to taxpayers. It's simple. Drug makers are gaming the system. They are using their monopoly power against the people of California. It is completely unjust and unacceptable. No family should struggle to care for a sick child when the highest paid pharma CEOs are taking home $8.5 million a year. Here in the halls of the Capitol, pharma is one of the most powerful players. Over the past 2 years, drug makers have spent more than $100 million on campaigns and lobbying activity. That is a very good investment when you're protecting $69 billion worth of additional profits. It's our duty to counterbalance their influence on the political process and demand answers for the public. It could have happened last year, but a similar effort stalled under pharma's pressure. In our victories over oil and tobacco, we've shown that a progressive coalition like the one you're looking at here can prevail in the face of entrenched opposition and deliver justice for the people of California. I am very optimistic that this year we can put drug companies under the spotlight, get out the truth, and help protect our families by introducing transparency and fairness to the pricing of these essential medicines. Thank you very much.
Good morning, everyone. My name is Jack Ribbon, and I represent Unite Here, which is the Hotel and Casino Workers Union in California and across the country. We have about 200,000 covered lives in California through our trust funds, through bargaining with our employers. About a month ago, under a similar sort of transparency bill, there was a hearing in San Francisco in the State Building regarding the increasing costs of our health care for large purchasers. Over 800 of our members of Unite Here showed up at this hearing carrying signs like this saying, "Who took my raise?" Because they bargain, they struggle, sometimes they even strike for months to get money out of an employer to cover benefits for themselves, for their families, for their children. And where does it go? It goes to pharma. So pharma and other aspects of the industry, but we found through the data that came out of this bill, transparency on data with respect to the cost increases in healthcare, is that one of the number one cost drivers of in the healthcare industry are pharmaceutical costs. And it's not about utilization. It's about increased prices. So we think this is an extremely important bill. Unite Here supports it firmly. We thank Senator Hernandez for authoring it and Assemblymember Chu for being a co-author. And we're going to fight this one all the way to the end. Thank you.
My name is Caitlin Vega with the California Labor Federation. We are here in strong support of this measure because there are few issues that matter more to our members and to all working people than the cost of the prescription drugs that their family members rely upon. When your child requires an EpiPen or requires insulin, when someone you love has cancer and depends on those life-saving drugs, you would literally pay anything to make sure that you're protecting their health. But working people cannot afford to pay anything. And that is why we cannot allow pharma to continue to raise the costs of prescription drugs every year. What's happened in this legislature has sent a message that no one's holding drug companies accountable, that our members, that all working families should just be forced to continue to pay as drugs go up every single year with no explanation and no rationale, when the exact same drug it costs more simply because they can charge more. There are no restrictions on that, and there's no explanation required. The members that we represent, the millions of union members in California, and the millions more who are not in unions but who struggle in the same way to provide these life-saving drugs for their families, are tired of waiting. We demand answers. We demand that the legislature take a side and stand with working families and say that our families deserve some protection from these constant increases in prescription drugs. So we thank Senator Hernandez for being our champion on this issue, as well as Assemblymember Chu. Our members are committed to this fight. They will fill the halls of this Capitol to tell their stories and to explain why this bill is so important. Thank you.
Hi there. My name is Anthony Wright. I'm the Executive Director of Health Access California, the statewide healthcare consumer advocacy coalition. Really proud to be a co-sponsor of SB 17 with the California Labor Federation, and thank very much the Senator and the Assemblymen for their leadership. During the campaign, President Trump vowed that he would bring down drug prices, and in fact said that the drug companies were getting away with murder with regard to their prices. That shows the populist anger that is out there, that is across the spectrum. Yet when he actually met with pharma CEOs a month ago, he seemed to capitulate to every drug company demand with no concrete commitments for consumers. His new FDA head is one of pharma's consultants and board members. He, at the pending health bill in Congress, would do nothing to lower prescription drug costs and, in fact, would increase cost sharing for medications for consumers, all while giving a massive tax break to the pharmaceutical industry. So while the President and Congress are focused on tax and regulatory giveaways for the drug industry, we need to make sure that California takes the lead on pushing back on prescription drug prices. The transparency legislation will provide public and private purchasers the information needed to better respond to prescription drug price hikes and negotiate better deals for patients. Californians deserve to know why their prescription drug costs are soaring and with no warning or explanation. These price increases are forcing patients to skip necessary medications and make the health system prohibitively expensive for all of us. So as the statewide healthcare coalition, we're proud to co-sponsor SB 17. While our effort last year didn't make it through the finish line, we went much farther than most Capitol observers thought, and we believe that we have new urgency and momentum for reform this year. The public anger over skyrocketing prescription drug prices is not going away. There's a reason that President Trump speaks, if not acts, on this issue. With EpiPen and every other high-priced prescription drug hike, we feel increased momentum for action on prescription drug prices, and we feel we can pass meaningful reform this year, given the new members and the new margins in this state legislature. The very close vote last year on a ballot on prescription drug prices shows that the public is ready for action. So with the federal government not expected to play a role, it's now time for California to take the lead on transparency and prescription drug price reform now. Thank you.
Well, good morning. Good morning. I'm Samir Ausri. I'm an internal medicine physician at Campbell, California, and I work for the Permanente Medical Group. I wanted to take a moment to actually thank Dr. and Senator Hernandez and Assembly Chu for their advocacy to address this issue on behalf of our citizens and actually my patients. The price of prescription drugs continue to increase at an alarming rate. From 2008 to 2016, the average price increase for brand name drugs was over 200%. You've heard a bunch of examples. EpiPen for people who have allergic reactions has gone up tremendously. If you look at insulin, which you see this poster here, a lot of my patients have diabetes. There's lots of insulins that have been around for 30 and 40 years, and the prices of these have gone up 300%. People simply cannot afford that. You talked about some very expensive medications going up, but how about some really common ones? Doxycycline, which I use for my patients who have acne or bronchitis, used to be $20. It's $1,900. The drug was created in 1960 something. Did the production cost really go up 8,000% over this time? Take, for instance, a hemorrhoid cream. It used to be $3. It's $54 today. Life-saving drugs like cancer drugs. Gleevec is a good example. It came out for a type of leukemia back in 2001. And at that time, the price was $26,000. 15 years later, the price is now $146,000. Did production costs really go up that much in 17 years? You would think they would go down. Look at any other industry, cars, televisions, you name it. After a while, the price actually goes down. But for medications, they continue to just go up. They actually quoted the CEO of Novartis to say, you know, the price of Gleevec is high, but it's fair, he said. The Kaiser Family Foundation did a survey of consumers who actually said that 1 out of the 4 were unable to actually afford their medications. And this happens to my patients as well. I had a patient who was on a heart medication, and it turned out that she was only taking half the dose because she could not afford it. What would have happened? She would have showed up in our emergency room. She would have been hospitalized for congestive heart failure, and this would have simply increased the cost to our healthcare system. So as a physician, I believe what you two are doing is really important for our patients. I think this bill will bring the much-needed transparency that pharma needs to be involved in, just like every other part of the healthcare system. I believe that they need to also step it up and make sure that healthcare is affordable to our patients and accessible by being transparent on their drug prices.
Good morning, everybody. My name is Christoph Stremikis. I'm the Senior Manager for Policy at an organization called the Pacific Business Group on Health. PBGH is a nonprofit membership organization that represents 65 large employers, many of whom are either based here in California or certainly all have a large base of operations here. Our members have long struggled under the high and rising costs of providing affordable coverage to their employees and their employees' families. Certainly a larger and larger proportion of this cost can be directly traced to the rising costs of prescription drug medication. We thank Senator Hernandez and Assemblyman Chu for their leadership on this issue. We've long experimented and been involved in the delivery system in California. One of the things we found that works in healthcare reform is transparency. As others have mentioned, transparency around provider performance, hospital performance, transparency for healthcare plans, that's worked. It's time to bring that to prescription drug manufacturers. Thank you both for your time and effort on this. I can say as a leading organization that represents a number of very large employers in this state, we're fully supportive of your legislation and look forward to working with you to get it passed this year. Thank you.
Before I open up to any questions, I'd like to acknowledge a colleague of mine, Senator Connie Leyva, who's here in support as well. She does have to leave to go vote at some committee hearings, but I'd like to acknowledge her. But give her a round of applause. At this time, I'd like to open up to any questions from the media at all. I'm sorry, who's first? We'll go over here.
So the bill says that it would require drug makers to disclose a price increase if it goes up by a specified threshold. What is that threshold?
So the threshold is based on the Medicare, for example, the Medicare Part D specialty drug threshold. For if it's below that, it's 25%. If it's above that, it's 10%. And we can make sure that my staff will get you any information you need on the specifics of the bill. And it is in print, I believe, right now. We crossed the desk yesterday.
Okay, thanks.
I think she was first, second, and then third. Yes. Sorry.
Senator, can you talk a little bit more about how this version differs from the previous version and why you think this will go forward?
Very similar. We added a few more things to it as well, some more specifics, but I think it's going to do what it should be doing. If you look at the comments I made earlier with regard to what the rest of the country is doing, there's 20 other states that are implementing similar types of law. If you look at the McCain bill at the federal level, a lot of the provisions that we had on 1010 are in there as well. And it's sort of ironic that the profit margins for the pharmaceutical industry this past year are just under 10%. So that tells you that transparency works. And you know, if you think about what's happening with the rest of the healthcare market, how everyone has skin in the game, including, let's say, health plans that have what's called medical loss ratio. Under specific federal law as well as state law, after a certain profit margin, they have to give it back to the consumer. This is real simple. It's just pure transparency, which is working already. And maybe we should have that conversation. Maybe they should be capped on certain profit levels. But we're not going to go that far. But this is a very modest bill. But despite the fact that it's modest, they have put tremendous amount of pressure, but more importantly, lobbying efforts just to kill this bill.
Any of the states pass anything? Are they just going through the process?
They're going through the process. I believe one other state, I think it's New Hampshire, if I'm not mistaken. Vermont did pass, you know, a similar type of bill, but there has been a lot of pressure amongst the lobbying efforts against any type of transparency measures. So yes, ma'am.
Senator, you alluded to the lobbying efforts around these issues, and last year, obviously, the effort that you had stalled.
Right.
This would be a big lobbying fight in any year, but we're now in the context of, as you alluded to, a lot of uncertainty around healthcare, around what's going on with the federal government, how that could affect California.
Yes.
Is there the bandwidth for a major lobbying and legislative fight on this issue, given all of the other things on your plate and on your colleagues' plates right now?
So I think they're going to just even double down even more. If you look at some of the statistics that Mr. Steyer mentioned, the amount of money that they've spent not only in lobbying but in direct contributions as well is astronomical. But let me make one thing clear. We don't know what the new healthcare law is going to look at. Now, I'm going to obviously go through every part of the state to make sure that we defend what we have. But there's one thing that's for certain. Whatever healthcare bill that we do have in the future, and whatever our healthcare system looks like, the consumer is going to demand lower costs in their premiums. That is a given. And it is our responsibility in government, whatever system we have to make sure that they have the absolute best price in their premium of healthcare. And as mentioned, and I will say this again and again, every segment of the healthcare system has skin in the game. Health plans, hospitals, providers. If you look at this new healthcare model that might come up, we're going to get even less money from the federal government for Medi-Cal. I see Medi-Cal patients. My rates have stayed steady since the mid-'60s and have not gone up, but yet I continue to see Medi-Cal patients. This industry literally has profit margins that are going through the roof, double digit, not compared to any other segment of the healthcare industry. So we have to address these immediately.
And just, sorry, a quick follow-up on that for Mr. Steyer. I know that your organization has spent money and resources on issues that have moved through the Capitol before. I'm thinking particularly about environmental laws. Do you plan on either advertising grassroots organization around this effort?
Well, we're not sure exactly how it's going to play out, but I will say this. We think it's important, as the senator and the assembly member move this through the Capitol, that the people of California are informed about what's going on and engaged about what's going on. Because just as we're talking about transparency here on drug prices, we want to make sure that this process is transparent so people in California who are paying outrageous prices for medical care and for drugs know what's going on and know who's representing their interests and who isn't.
Question.
I'd just like to better understand why you think this bill has a shot this year, given its fate last year. What's different and why do you think it has a better shot of getting?
So Assemblymember Chu made a comment in his presentation about his bill that didn't even get out of the Health Committee, which we didn't even get to analyze it on the Senate side, and it goes to show you how difficult it is to move legislation like this because of the opposition. Our bill, and now I'm glad that Assemblymember Chu is on board as well, has made it further than anyone has ever expected, and it was amended in Assembly Appropriations. And I pulled it because I didn't think it went far enough because of the amendments. I also believe that because there's more scrutiny now on this issue, You look at what happened nationally with regard to Bernie Sanders. You're looking at consumers that are afraid of losing their health insurance and increasing costs of healthcare prices. You know, we are set to potentially move this to the floor and get a signature. And I'm more confident this year than last year just because of the ever-changing momentum, but in particular with the 20 states that are introducing laws as well. So I'm confident and I'm optimistic. And there's no way that, you know, that I'm in the, as long as I'm in the legislature, that I shouldn't try to make sure that we bring this attention to the public as well as to the consumers. Yeah, sure.
One thing I'll mention is since I introduced my bill in 2015, Martin Shkreli had not been arrested for fraud at that time. We had not seen the EpiPen spike and all the profits that had been earned off of that. We did not have a president who had said we need to go after the skyrocketing drug prices. And to answer the last two questions together, in a context where our state could lose billions of dollars in our healthcare system, there's enormous pressure on Sacramento and on our state to figure out where we can find some legitimate cost savings. And all of us believe that since we have used transparency with regards to doctors and hospitals and insurance plans, and they've helped the state save healthcare dollars, we need to do the same in this sector. Because we know there are savings to be found, we need to turn over every rock to make sure that our patients and our consumers and our seniors are being taken care of.
Questions? Any other questions? Seeing no other questions, I'd like to thank all of you for being here. We will stay for a little while. I'll stay longer if you want to ask any individual questions. Again, I'd like to just close by thanking everyone up here, the coalition, for all their hard work, but more importantly, that the issue is so important that we have to make sure that the public knows that as we move this forward. Thank you very much.